Hey everyone, I know pharmacology can be tough. So today we're going to cut through the noise and break down anti-leprosy drugs into the absolute must-know facts for your nursing exams. Let's get right into it. So what are the really critical risks of these drugs? And more importantly, what are you going to do about them? Getting this right isn't just about scoring well on a test. It's about keeping your patients safe. We're going to cover the three main drugs you need to know. First up, Dapsone. Okay, when you hear Dapsone, I want your brain to immediately scream one word: anemia. This is its biggest, most important side effect. You can't miss this one. So Dapsone can cause anemia and even haemolysis. That's where red blood cells actually break down. Your job? Monitor your patient for signs like fatigue, looking pale, or being short of breath. It can also lower a type of white blood cell, which puts your patient at a higher risk for infection. But here's the absolute critical safety point. Dapsone is a total no-go for patients with severe anemia. Always check their history and their lab work. The main takeaway is simple. Dapsone equals anemia. All right, next we have Clofazimine. This drug has a very visible side effect that your patients are definitely going to notice. Clofazimine is known for causing a red-brown discoloration of the skin. Now, that can be pretty startling for a patient, right? So your number one nursing action is patient education. You need to reassure them that this is a totally expected and harmless side effect of the medication. That simple conversation makes all the difference. And our final drug is Rifampicin. This is a real powerhouse antibiotic used for lots of things, not just leprosy. But it comes with some serious risks and one incredibly famous side effect that loves to show up on exams. With Rifampicin, you have to think about the liver. It can be hepatotoxic, which means it can cause liver damage. So your top priority is keeping a close eye on those liver function tests. It also has that classic side effect we need to talk about, which is a huge patient education point. Yes, this gets its own slide because you absolutely cannot forget it. Rifampicin turns body fluids like urine, sweat, and even tears a reddish-orange color. Now, it's harmless, but can you imagine how scary that would be if no one warned you? You have to tell your patients to expect this. It can even permanently stain soft contact lenses. I can almost guarantee you'll see this on an exam. Okay, we've gone through the big three. Now let's lock it all in with a super simple memory tip that will help you nail this on your exam. Just remember ACR. A for anemia, which points you to Dapsone. C for the skin color change from Clofazimine. And R for the red-orange fluids you see with Rifampicin. ACR, that's all you need to remember. And that's really it. At the end of the day, pharmacology isn't just about memorizing a list of facts. It's about patient safety. Master these key points, and you're one step closer to being a safe, confident, and effective nurse. You've got this.